Hello, everyone. How's everybody doing out there today? I hope you are doing well. I hope you're having a wonderful Sunday. It is Sunday, June 3rd. It is 3:07 p.m. and it's time for Talk with the Doc. Yay! I'm going to give you guys a couple minutes to go and share this video with other people. Get the men in your life who you love to come and watch this video. And if you can't get a hold of them, then you come watch the video and give them this information because you need this information, right? If you join in the show, go ahead and leave a comment, leave a wave, say hi so I can know who you are and I can acknowledge you. Hey there, Miss Melinda. Thank you so much for watching. I hope all is well with you. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand through my best-selling book, The 12 Secrets of Divine Health. Yes. Hey, Miss Karen, thanks for watching. Yay, my best-selling book, 12 Secrets of Divine Health. We're going to talk about some of those things today. Through my book, through my concierge medical practice, Abundant Life Concierge, through my health, wellness, and weight loss coaching with the Dazzlers with Dr. Nicole, I help pastors and busy professionals, folks who are overworked, overwhelmed, and overweight to transform their mind, body, and spirit so that they can have a greater impact on the world around them. Now look, today we're going to be doing a lot of the secrets. I'm going to be giving you a lot of the secrets in my book, The 12 Secrets of Divine Health. But if you want to get your copy, you can go to 12secrets.net to get your e-copy, your electronic copy, or you can go to divinehealthbook.com to get your actual autographed copy. All right, so go get your book today so that you can read all 12 secrets, so that you can learn what are the 12 secrets to divine health. But we're going to talk about some of them today. All right, it's June, guys. June. Did you guys know queens are born in June? I wonder whose birthday's in June. Yes, queens are born in June, but June is also, there's a lot of national health awareness that goes on in June, and we're going to hit one of those every week this month. Every week of this month for Talk with the Doc. But today we're going to talk about men's health. June is National Men's Health Month, right? So we're going to talk about men's health because, you know, a lot of guys, they don't like to come to the doctor. You know, I've been a doctor now for 11 years, and I can honestly tell you a lot of guys don't like to come to the doctor. I don't know why. They need to be healthy and they need to come and see us, right? So we're going to talk today about men's health. So I'm going to give you a couple more seconds to go run and grab the man that you love. Ladies, whatever, however you got to get him. You know, they say the way through a man's heart is through his stomach. So if you got to tell him you're going to cook him something, tell him, you know, to come and watch this great show. Whatever you got to tell him to go come and watch this show so that they can learn all about men's health, right? All right, well, let's go ahead and get started. So I'm going to give you 6 tips. This is the 6th month of the year, June, the month of June. So I'm going to give you 6 tips on how men can stay healthy. All right, tip number 1, men, you need to eat healthy. Right? You've got to eat healthy. Guys, you've got to eat more fruits and vegetables. You know, I know a lot of guys are they're like the steak and potatoes type of guys, right? They just want the meat and the carbs, right? You know, because, you know, we're big manly men. But guys, you got to eat your fruits and your vegetables. That's going to help keep you regular. Keep those bowels moving. Yeah, keep you regular. It's going to help your skin to stay nice and hydrated and skin to look good. It's going to keep your heart healthy, right? We want our hearts to be healthy because, guys, we know that guys have higher numbers when it comes to heart disease, right? And so we want you to stay healthy. Did you know that men have a higher death rate in terms of the leading causes of death? Things like cancer, heart disease, diabetes. So men have a higher death rate. So men, you've got to eat healthy to stay healthy, right? All right. So we also know that on average, I'm just going to throw out some facts throughout today, is that men live about 5 years less than women, right? So guys, we want you to live long and prosper. But in order to do that, you've got to eat healthy, right? So tip number 1 for the men in your life, you've got to eat healthy. And ladies, if you are cooking for a man, your dad, your son, your husband, your boyfriend, whoever, make sure that you are cooking them healthy meals. Make sure that you're incorporating those fruits and those vegetables in those meals. Make sure that you're using the healthier fats, you know, things like avocado and nuts. Don't use the canola oils. Use more of the olive oils if you have to put something in oil, right? We want to eat less fried foods, more baked foods, more grilled foods. I know, fellas, you like to be out on the grill, right? So go ahead and grill that food. It's healthier for you, right? So, guys, you got to eat healthy. That's tip number 1, is eat healthy. Tip number 2, guess what Dr. Nicole's going to tell you? You guys already know what Dr. Nicole's going to say. Exercise. Yes, guys, you need to go exercise. So, now basketball is great. You know, a great rousing full court game of basketball where you're running back and forth is a great form of exercise. But guys, that's not quite enough, right? You've got to do exercise. What are the recommendations? 30 minutes of exercise minimum, so you can do more. 30 minutes 5 times a week, right? That will help to increase and improve your cardiovascular health, improves your heart, it improves your labs, your blood sugar, your cholesterol, your cardiovascular return. So you get to be less winded the more you exercise and the more you do. You can run up those steps without getting tired, guys, right? Yes, right. So you've got to exercise. And guys, exercise, it involves stretching. Yeah, I know a lot of guys don't like to stretch, but guys, you got to stretch, right? You've got to get those muscles, fibers nice and stretched so that you're not tearing things while you're exercising. Guys, I know a lot of guys do the weights, right? Because that's what they think of, I'm going to go exercise. They're going to go lift weights. And lifting weights is a good thing, but guys, don't forget about stretching and don't forget about cardio. Guys, the cardio is what actually increases that cardiovascular supply, and that's where you can actually burn fat, where you can still build some muscle while you're doing the cardio, but you're burning the fat. That fat around your heart. You're getting rid of the things like fatty liver. Hey, Miss Fache, thanks so much for watching. You're getting rid of, like I said, you're lowering your cholesterol, lowering your blood sugar, improving your heart, lowering your risk for heart disease. And so you've got to do that cardio, guys, right? So 30 minutes of cardio at least 5 times a week. Even if that just means you're getting out and you're taking a jog or taking a walk, taking a run, getting on the bike. But do some form of exercise, of cardio 5 times a week. All right. So tip number 1, eat healthy. Tip number 2, exercise. Tip number 3, stop smoking. Fellas, you gotta stop smoking. If you are a smoker, cut it out. Right? And I know it's easier said than done, but if you are a smoker, you need to go and get some help about stopping smoking. By stopping smoking, you can add years to your life. You can add years, take years off of your skin, right? And you won't look as old, right? You won't feel as old. You'll feel better if you stop smoking. You'll save some money, big time, save some money. I tell my my patients, if you're a smoker, to take the money that you would have bought the cigarettes with and put it into a jar, and then at the end of the year, take yourself on a trip with that money, right? It'll be a lot of money too, especially if you are a regular smoker. You're smoking like a pack a day or a pack every other day. That's a lot of money that you're going through, and you will save a lot of money by by stopping smoking, right? All right, so tip number 1, eat healthy. Tip number 2, exercise. Tip number 3, stop smoking, right? Tip number 4, and this is a really important one, guys, you've got to mind your mental health, right? Mind your mental health. I know that a lot of guys, they like to tend to bottle up their feelings, right? They want to be the macho man, right? They don't want to show anybody that they're hurting or that they're sad or that they're angry or that they're depressed, that they're anxious, that they're having problems sleeping, that they're having problems coping. But fellas, you can't bottle all those feelings inside. You've got to find a healthy way to express those feelings, right? And you've got to be aware of what's going on. You've got to know that mental health matters, that mental health is important, because like Dr. Nicole always says, we are one body, one being with 3 parts: mind, body, and spirit, right? So we have to mind our minds, right? Our mind matters. Absolutely, our mind matters. So guys, don't bottle up those feelings inside. Go ahead and let it out. It's okay to cry, right? It's actually cathartic, which means you actually release things. You release things when you cry, right? So don't bottle that up. Let it out. All right, guys, don't bottle up anger. Let that out. That can really take years off of your life. It can cause high blood pressure. It can cause increased heart rate. It can cause increased cholesterol and blood sugar. It can do a number on your skin, on your kidneys, on your heart, on your lungs, right? So guys, don't bottle up that anger. Find a healthy way to, even if it's just going to the gym, because I love exercise, and taking it out on doing on a machine, doing some cardio, doing some kickboxing, doing some punching bag, right? But you want to handle your anger and your emotions in a healthy fashion, right? Guys, don't be afraid to talk to someone. If you need to go, if you're having problems with depression, if you're having problems coping, if you're having problems with anxiety, problems sleeping, go talk to your doctor. Go talk to a therapist. Go talk to somebody who is licensed and certified to actually help you, right? And don't be afraid. It's not any less manly to show your emotions and show your feelings, right? Ladies, we love it when a guy shows their emotions, right? In a healthy way. So guys, don't be afraid to show your emotions. It is good for your health. All right, so number 1, eat healthy. Number 2, exercise. That's stretching, cardio, and weights. Number 3, stop smoking. Number 4, mind your mental health. And number 5, get some friends, right? Enjoy the guys. Go on a guys trip. Go on a guys night out. Go have some fun with your friends. Guys, it's so important that you hang out with your friends, right? We have a community. We're no man is an island, right? So you need to have friends. You need to have somebody who you can just go and be yourself, who you don't always have to put on airs with, somebody who you can just, excuse me, have a good time with, right? You can just sit back and talk. You can play some cards. You can, shoot some hoops, play some basketball. You can just dance, go to, listen to some music, sit out, put some food on the grill. But you just need to be able to unwind and hang out with your guys, right? Hang out with the fellas, have some fun. I think it's a great thing when guys are in like fraternities or groups where they can just have camaraderie and they can hang out with people of a like-minded spirit, like-minded mindset. So it's really good, guys, that you have a community around you. Enjoy your friends. That is so important for your health, right? For your mental health, for your physical health, and for your spiritual health. Enjoy your friends. All right. Number 1, eat healthy. Number 2, exercise. Number 3, stop smoking. Number 4, mind your mental health. Number 5, enjoy your friends. Get some. And number 6, last but not least, go see your doctor. Yay! Go see your doctor. Ladies, if your fella doesn't want to go see a doctor, you make the appointment for them, right? You call and make that appointment and just let them know, hey, we got to go somewhere. Tell them that they're taking you somewhere, right? And then when they get there, it's their appointment, right? Because sometimes we got to do what we got to do to get our guys healthy. So we've got to see your doctor at least annually. That means every year, right? So when should you start getting screenings? Everybody should start getting screenings at least at 25 to get a baseline. And that's only if you don't have any chronic medical issues. If you've got a family history of things like diabetes, heart disease, high cholesterol, heart attacks, strokes, if you have a family history, then you actually probably need to go earlier. Probably need to go at 18. But if you don't have anything in your family history and you are fairly healthy, you're at a healthy weight, you don't live a sedentary lifestyle, you get out there and you exercise, you have you eat right, then you still need to go. Even though everything looks right, you still need to go at least at 25 and get screened. What are they going to do at that screening? They're going to check some blood work. They're going to check things like your cholesterol, your heart, your lungs. They're going to listen to your heart and lungs. They're going to check all your muscles. They're going to look in your eyes. They're going to check your vision. They're going to check your hearing. They're going to look in your mouth. They're going to look at your skin. They're going to check labs. They're going to check your electrolytes, your sugar, your kidneys, your liver, your thyroid, your cholesterol, right? So these are the things that we're going to do at an annual physical starting at age 25 if we don't have any other medical issues, starting at age 18 if we do have a family history or our own past medical history is not without any complications, right? So 25, guys, I need you to go and get a physical, right? What kind of things are we looking for? We're going to do, like I said, a heart, diabetes, and cholesterol screening. A healthy heart, blood pressure needs to be below 120 over 80, right? Your sugar should be 100 or below fasting. Your cholesterol, your total cholesterol needs to be 200 or below, right? Your triglycerides, that's how much fat is in your bloodstream, needs to be 150 or below. Your good cholesterol, we want that to be nice and high because that helps to take fats away from your bloodstream. We want that to be above 40. We want your bad cholesterol to be below 100, right? So let me say that one more time. We want your total cholesterol to be below 200, your triglycerides, that's the fat in your bloodstream, to be below 150. We want the good cholesterol to be higher than 40, and we want the bad cholesterol to be lower than 100, right? So what other kind of screenings are we going to do? Well, guys, colon cancer screening, right? We need to make sure that you don't have any colon cancer. If you have a family history of colon cancer, you need to start that screening 10 years prior to when that person was diagnosed. So if you had a father that had colon cancer at age 50, then you need to be getting your screening at 40. Hey, Dr. Alex, thanks for joining in. Guys, they actually just came out. I want to say this past week I read an article in Medscape that they just came out. They lowered the colon cancer screenings for men as well. About 2 years ago they lowered it for women to age 45, but it was still age 50 for men. But I think it was last week I just read this article that it was lowered for men as well. So they're encouraging men age 45, you need to be going and getting a colonoscopy, fellas, right? And if you have a family history or you're high risk, maybe even earlier than that, right? And we do know that men, minorities, African Americans and Hispanic men have higher incidence of colon cancer, so you really need to be getting screened even earlier, right? But 45 now is the age for men to go and get a colonoscopy. Guys, listen, it's one time. If it's normal, you don't have to go back for 10 more years, right? So it's easy peasy. They don't hurt. You just got to drink this drink that makes you go to the bathroom the day before, and then you go. They kind of put you to sleep a little bit, kind of make you very relaxed, and it should be over within about 10-15 minutes tops. And like I said, if it's normal, you only have to do it once every 10 years, right? All right, so colon cancer screening, age 45. Prostate screening. Now, this has been a little bit of a controversy. It used to be, we used to check at age 40. Then they said age 50. Then they said stop checking unless you had a reason to check or a family history. But now we're back down to between 45 and 50 depending on symptoms and family history. So guys, if you are seeing your doctor regularly, then your doctor will know when is the correct time to screen for you. Now, screening can be as simple as a blood test to check a PSA. That's a prostate specific antigen, right? That number should be less than 4. Or they also need to do a digital rectal exam. That's a finger in the bottom. Yes, guys, you need to have that done to check the size of your prostate, to see if your prostate is swollen, to see if your prostate is tender, to see if you've got an infection or prostatitis in your prostate, right? So these are the important things that we need to do for prostate screening. And most prostate screenings, at least with the digital rectal exam, needs to start at age 40. Now, guys, don't let that be the reason that you don't go in, right? And if you refuse to have that done, then at least get that PSA checked, right? All right, so along the lines of the prostate, guys, at your appointment, we're also going to ask you about lower urinary tract symptoms. That's LUTS, lower urinary tract symptoms. Now, if you've got some of these lower urinary tract symptoms, then that might be reason that we check your prostate PSA a little bit earlier than going ahead and delaying it. And those symptoms are urinary frequency. So that's when you're going to the bathroom multiple times, like you have to go every 1 to 2 hours, especially nighttime urinary frequency. So we call that nocturia. So if you're waking up 3 and 4 times at night to go to the bathroom, guys, that could be signs that your prostate is getting large. Now, let me tell you this. As you get older, your prostate is going to enlarge. That's part of getting older. Like I tell some of my patients, that's a good thing. Getting old beats the alternative, right? It means you're still alive. So as you get older, though, your incidence of prostate getting larger is also going to go up. So they say that it's by age 40, 40% of guys have an enlarged prostate. By age 50, 50% of guys have an enlarged prostate. Age 60, 60%. Age 70, 70% of men. Age 80, 80% of men have an enlarged prostate, right? Now, this is not prostate cancer. This is just enlargement of the prostate that can then cause those lower urinary tract symptoms. So if you've got frequency where you're going to the bathroom a lot, if you've got hesitation where you kind of have to stand there and give it a little pep talk before the urine comes out, so frequency, hesitation, if you've got a slow stream so it's not coming out strong like it used to, if it kind of dribbles out, then these are signs that your prostate may be enlarged and that you need to go and see your doctor a little earlier to just have some screening done for your prostate, right? Now, if you don't have any of these, then you still need to go and get your PSA checked sometime between age 45 and 60, sometime in there, even without symptoms, right? But if you have any of those symptoms, then you need to go a little bit earlier, like 40, all right? So those are the things I wanted to talk about today. Men's health. I want you to eat healthy, fellas. I want you to exercise. That involves stretching, cardio, and weights. I want you to stop smoking. I want you to mind your mental health. I want you to enjoy your friends. I want you to go out with the guys, hang out with the fellas sometimes. I want you to, and last but not least, I want you to see your doctor at least annually, and I want you to get your screenings, right? Your colon screening, your prostate screening, your heart screening, your sugar, your cholesterol, all of these screenings need to happen happen at least once a year. Okay? All right. So like I said, June is National Men's Health Month. So I just wanted to come to you guys and talk to you about how to keep the men in your life healthy, right? And all of those things are in my book, The 12 Secrets of Divine Health. 12 Secrets, guys. You can get a copy at 12secrets.net or divinehealthbook.com. 12secrets.net is going to get you the ebook. Divinehealthbook.com is going to get you an autographed actual copy of the book, right? Absolutely. So thank you guys so much for joining me for Talk with the Doc today. We are, like I said, for the month of June, we're going to talk about all kinds of things. Each week, we're going to talk. One week, we're going to talk about safety. We're going to talk about HIV. We're going to talk about Alzheimer's. We're going to talk about lots of different things. It's going to be a fun month. You know, this is a great month for me. This is my birthday month, so I enjoy the month of June. So, guys, I really want you to, everyone, I really want you to watch Talk with the Doc, 3 p.m. Eastern Standard Time. Oh, I did want to say I am wearing blue today because since June is National Men's Health Month, you wear blue to support men's health awareness, right? So I'm wearing blue today. You guys make sure you wear blue to support men's health awareness. And if you guys have men in your life who you love, make sure you share this video with them. Make sure that they know what they can do to stay healthy, all right? Thank you so much again for joining me today. I'm Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Through my best-selling book, The 12 Secrets of Divine Health, through my weight loss wellness coaching with the Dazzlers with Dr. Nicole, and through my concierge medical practice, Abundant Life Concierge, I help pastors and busy professionals, folks who are overworked, overwhelmed, and overweight, to transform their mind, body, and spirit so that they can have a greater impact on the world around them. Thank you so much for joining me, and I will see you next week on Talk with the Doc, 3 p.m. Eastern Standard Time. Have a wonderful day. Bye-bye.